watch up on the live stream. Just whenever you get ready.
Okay. Say it again?
Do you teach just nursing students?
No, I teach health informatics. So I'd like to welcome everyone this afternoon, and thank you for taking the time out of your day for this discussion about training leaders for a culture of quality and safety. A little bit about me. First, unfortunately, I don't have anything to disclose. I wish I did, but I don't. And a little bit about my background. I'm a nurse, and I spent the early part of my career in adult cardiothoracic ICU, and then I moved over to pediatric open heart, open lung major trauma, where I worked at Children's Hospital in Los Angeles for about a decade and a half. I have a master's in education and a PhD in education and also in information systems and technology. A majority of my research is around anything having to do with health information systems. So an information system that collects any kind of health data, whether it is a Fitbit that you wear or whether it's an electronic health record. And everything in between, all the way up to eHealth Exchange, which is our nation's health information network. So today I'm going to be talking about training leaders for a culture of quality and safety. This is based off of a study that we did at University of Alabama at Birmingham, where I am the director of graduate programs in health informatics in the School of Health Professions. My co-authors on this study are listed here on this slide, and the current program director is Dr. Allison Hall. When I did this study and published a couple of other things around healthcare quality and safety and informatics, I was then interim director of the program, and I'm very fortunate that Allison Hall has now taken it over permanently. This talk today will be primarily about a program that we have at UAB called Quality Academy. And so a little bit about why we did this study. We wanted to see to what degree a culture of quality and safety exists after healthcare workers had gone through this program. So a little bit about how the program is organized. It is a 1-semester, 4-class program that is primarily online with some in-person sessions on Friday, Saturday, and a half a day on Sunday. And it gathers healthcare workers from across the UAB health system. And so when I talk about leaders and I talk about across the healthcare system, I mean leaders at any level. So, the program is designed to be interdisciplinary and to develop teams of people who can put forth a culture of quality. So a little bit more of some background into developing a culture of quality and safety. Some studies in the literature say that if you have a culture of quality and safety, you will have improved patient experiences and improved quality of care. So when I talk about culture, and I'll define culture in the next slide, or the slide after that, when we talk about a culture of quality and safety, this is something that is deeply embedded in an organization. This is not something that is mandated from the top down and is only carried forth in an organization through C-level people or people at the very top. Others suggest, though, that there's no way to have a culture of quality unless you provide people with data, and that providing them with data really isn't enough, that you need to teach people how to interpret data and then how to act on those data. And so creating a culture of quality in healthcare requires developing a critical mass. And a critical mass does not happen overnight. A critical mass happens very, very slowly, and it doesn't just happen from the top down. It happens from the top, from the bottom, and from sideways. So the definition that we looked at for healthcare quality and safety comes out of the UK. And we felt that it was the best definition that fits the culture of quality and safety in a healthcare organization. So now on to developing leaders. So the ability of an organization to support and sustain the required quality, culture of quality, is an important thing to think about, because organizations need to look at to what degree are they going to do this? What kind of investment are they going to make in changing the culture? And as I have mentioned, there's been a long-standing approach that this can be mandated, this can be somehow forced upon people from a top-down approach. And what we have found over the 10 cohorts that we've had, actually now 11 cohorts that we've had, is that this just does not happen from the top down. In fact, it rarely happens from the top down. What does happen from the top down is the support for changing the culture into one of quality and safety. And so the way our program works is that hospital workers are the education is paid for by the health system, and what we did was we got together with the health system and the School of Health Professions on our department, Health Services Administration, and designed a curriculum. And the health system actually pays for people to go through it. And so that's where the top-down comes from, is in the support and in the investment. And what we find is that employees like knowing that somebody's investing in them. So one thing that we realize from the literature is that when you are trying to change a culture, and in this case, develop and sustain a culture of safety and quality, it takes transformational leadership. And again, this is leadership at all levels. This is not just leadership from the top down. And the literature goes on to further say that what happens when you invest in your staff or you invest in your healthcare workers, that there's a sort of energy liberation that happens when people at all levels get together in an education or learning environment. And then what that does is it creates more solid teams that tend to have better outcomes. And not only are the short-term outcomes better, but the sustained outcomes are better. So a little bit more about our program. We looked at the importance of leadership. We looked at the importance of creating ownership of the processes and working as a team. So not any one department in the health system owns the process behind quality and safety, or creating or sustaining the culture of quality and safety. Everyone owns it. And in fact, anecdotally, people will tell you that once they've gone through Quality Academy, And they get these pins, and they wear these pins on their lapels around the hospital. And it creates, it's almost like a fraternity or a sorority, and it creates conversations that wouldn't normally happen, and conversations between people of all levels. So they may be in the elevator and see one another, and they may not have been in the same cohort, and they may not have even known that somebody else went through the program. And what we're finding is that these people who have gone through Quality Academy, even at different times, through different cohorts, are now starting to have conversations and starting to look at quality a little bit differently than they did when they were doing it within their own cohort or even within their own team. And so that's been a nice byproduct of presenting graduates with these pins that they wear on their lapels. So a little bit about our study. We looked at 6 different factors. We looked at teamwork climate, safety climate, job satisfaction, stress recognition, working conditions, and perceptions of management. We used the ASQ, which is a validated survey instrument, and the reason why we used this survey instrument is because it is down, the unit of measurement is the person, and the unit of measurement is the person across any unit. And so what I mean by that is that there are several other survey instruments that look at the unit, so everybody has to be in the same unit. Because a lot of most of the Quality Academy participants are from across the health system, we needed to find a survey instrument that could facilitate that. And so we had 192 responses. 54 of those were usable, resulting in a 34% usable survey response rate, which is actually pretty good. And so what we did was we sent the survey out to all alums, gave them about 6 weeks to answer the survey, 3 reminders, so not a whole lot of reminders, but strategically timed reminders, and we felt like we got a pretty decent response rate. So what did the survey show? So the survey showed that 78% of those who responded feel that they're working in a culture of quality and safety. So remember that these are graduates of the program. They graduated anytime between 2012 and 2017. So some are more, longer graduates. I don't want to say older, but they graduated earlier than others. And almost 60% are now in a leadership role. So one thing that's important to understand around the way we did Quality Academy is that participants were recommended or nominated by someone else, and they were nominated for a variety of reasons, but one of the factors had to be that they had to have potential to be a leader. It didn't mean that they had to be a leader right now. It meant that they had to have leadership potential. And so what we asked was, in this question in particular, what we asked was, what was your role when you entered Quality Academy, and what is your role now? And so the ones that entered Quality Academy that did not have, were not in a leadership role when they entered, almost 60% of them are now in a leadership role. About a year before we did our survey, the health system administered a culture of quality and safety survey by AHRQ, their standardized instrument, and that was administered across the entire health system. So ours was a subset of the entire health system in that it was just graduates or alums of the Quality Academy program. Whereas the one that was done about a year prior to ours was across the entire health system. And at that point, 63% of the respondents felt like they worked in an area that had a culture of quality and safety. And so even though our sample size is smaller, it's a little bit more targeted. I think what it shows is that once people have gone through Quality Academy, they tend to sustain that culture of quality and safety. So what did we conclude from this? And you know, one of the things that we think about is answering the question, so what? Like, so why does this all matter? You know, who cares? So is what we're doing helping? So some of the things that we found from our study is that a culture of quality needs to develop slowly over time and at all levels. So one of the areas of pushback that we've received is lots of questions about ROI. Everybody wants to know what's the return on an investment. It's very difficult to quantify safe care, right? It's starting to be done a little bit more now, and you're starting to find studies in the literature, but it's very difficult to quantify every single bit of everything that we do in healthcare. Very easy in banking, very easy in other disciplines. But sometimes in healthcare, we do things because it's the right thing to do. Intuitively, we just know. We know it's the right thing to do. And so we are just now starting to look at how can we quantify the participants in Quality Academy. So what happens is towards the end of Quality Academy, in a group, they do a quality and safety project. It's a pretty extensive project, and it's all done at UAB. And so we have people from multiple levels all coming together and doing a quality and safety project together. And now what we're starting to do is go back and look at some of those projects and see the degree to which they've been able to be sustained and the degree of like how we can monetize them. And so we're just now starting to look at that. Another thing that we realized that was really important is that people like ownership over the process. And so whether it's a nurse, a pharmacist, someone from housekeeping, someone from engineering, a physician, whoever has gone through Quality Academy, they want ownership over the process. And this is the investment that they're making in themselves. And they feel what we found out is that when they feel a pride of ownership in the process, it tends to sustain a little bit longer. And so what we're starting to do now, and one thing that we realized is important, is to foster opportunities for people to take this culture that they have had a hand in building into their new role. And as I mentioned on a previous slide, that a lot of the graduates of Quality Academy have now transitioned into leadership roles. And so it's important that they're able to carry their knowledge and expertise into those new roles. Another thing that I mentioned about how Quality Academy is designed, it's designed to be interprofessional and as a cohort. So now that we've had 11 cohorts go through, what we're starting to find is that the cohorts are starting to talk a little bit more amongst themselves, and this is a really good thing. And so, you know, if you think of each cohort as its own little dot, and the dots just getting bigger and bigger and bigger, so the cohorts kind of getting themselves don't get larger, but we start having more of them, they're going to collide in a good way, right? They're going to start to mesh together, and so that's been a really good thing. The other thing that we found out is that once people move into a position of leadership, they are more likely to sustain a culture of quality and safety. And so that has to do with some institutional buy-in and some capital that they've developed along the way. One of the things that we looked at when we did this study was looking at the people first theory. And so people first theory talks about having the right people at the right place at the right time, and having a people perspective instead of a program perspective or a top-down perspective. And so hopefully now you've noticed that there's some common threads across what we did with Quality Academy. And one of those things was making it people-centric. Not physician-centric, not nurse-centric, not clinical-centric, but making it people-centric. And so what we found was that's contributed to the success and the sustainability and also the spread of Quality Academy. Instead of only having supervisors nominate people, we now have people asking to be nominated. And so that's a good thing to be able to develop that kind of interest in the program. So now I'd like to open it up for any discussion. Here's my contact information if you want to contact me. If you want more information about Quality Academy, Allison Hall, who I mentioned, she's the director of the graduate programs in healthcare quality and safety, and she's now the director over Quality Academy. But I would like to take some time and answer any questions that you might have about how we went about creating a culture of quality and safety, or our program, or the options that are available. I will say a couple of things about it. So I mentioned in the beginning it's 4 classes. It is an actual graduate certificate. And so you earn actual graduate credit. So all of our graduates, it's transcriptable, right? So it's on their transcript. And we also have a master's degree in healthcare quality and safety. And what we find is that about 70 to 80% of those who've gone through Quality Academy go on to get the master's degree. And the thing that's nice about that is that those 4 classes that they took count. So the first 4 courses in the master's degree are now waived because they've already done them. And so that's an advantage around with the participants of Quality Academy. We are now opening, so Quality Academy to this point has been only UAB employees, UAB Health System employees. And we're now starting to open Quality Academy to other groups outside of UAB Health System. And so if you'd like any information on that, I'm happy to give you any information on that. I think also some of the information from our study could be very valuable if at St. Vincent's you wanted to think about how do we take what we're currently doing in quality and safety and blow it up and make it bigger and make it more widespread and make it more sustainable. And so we have some good lessons learned from our own program that we want to share with programs across the nation who are looking to do this very same thing. Most health systems have some sort of quality and safety training or quality and safety program. And if they want to blow them up and make them big, then we've got some lessons learned. There are some health systems that don't have any program at all, or they're trying to grapple with how do we even get this off of the ground, and do we even do this ourselves? And that's why we've been approached from some health systems from the outside, and so we're starting to open this to the outside. Other thing that I will mention is, as I was talking with somebody earlier before this started, this is based off of a paper that will be published probably next week or the week after that. It's at the publisher right now. And so I'll be happy to provide that to you so you can have the whole publication. So I'd like to open it for any questions and comments. Yes?
How do you measure quality or define it, and how do you know if you're having an increase in quality, whatever quality might be?
So in the, do I need to repeat the question? Okay. So the question was, how do we define quality and how do we measure quality? Is that, okay. So the definition that we use for quality is pretty broad, right? And so we use the one from the UK, and we looked at group values, attitudes, and competencies. And then what are the patterns? In terms of measuring quality, so in our projects that the students are doing, they look at before and after. And so, if there's something that they're implementing, so I'll give you an example. We have a paper that's just getting published now that's looking at a septic shock protocol. And this septic shock protocol was a paper-based protocol. And there were some issues with it. And people felt like, if we could integrate it into the EHR, that's a process improvement that's going to improve the quality of care, we hope. And so if we could integrate it into the EHR, would we have better care? Would the protocol be followed or adhered to in a more timely fashion? And the answer was yes. And so we looked at what was done beforehand, we implemented something, and then we looked at what was done afterwards. And so it's basically pre and post. Other questions or comments? I'll leave this up here. Okay. Any other questions? So I'm happy to hang around afterwards. I know this was a little bit short.